The question that followed our article and video on the 6 reasons to remove breast implants was, what happens after removal? What can be done to improve the breast without reinserting implants? Today we have the answer. Hello, I'm Associate Professor Dr. Pornthep Pungrasmi, a plastic surgeon from the B-Contour team, experts in breast and body contouring. On the channel Talk with a Surgeon by B-Contour. In this video, we'll discuss 2 options for breast implant removal. Before we start, please subscribe, like, share, and hit the notification bell, so you won't miss any great tips from the B-Contour plastic surgery team. Breast implant removal is a very common issue, ranking among the top 10 plastic surgery procedures in the United States. But the main concern for many people considering removal is how their breasts will change. Especially those with large implants, they fear their breasts will be saggy or flat. They wonder if they'll ever be firm again, or if extra procedures are needed to improve the look. There are 2 options patients should know before removal. Option 1 is simple removal, then waiting to see how the breast adjusts. The breast tissue and skin will naturally contract, which can tighten the area by about 20 to 30%. After this adjustment, the breasts might still sag, or they might not. Generally, if there's plenty of natural tissue and the implants were small, the breasts weren't stretched much. So after removal, they might not sag significantly. However, if there's little natural tissue and the implants were large, the breasts were stretched so much that the skin might not contract enough, leading to sagging. Option 2 is removal combined with a breast lift. This involves removing excess skin, reshaping the breast for a better look, and repositioning the nipples and areolas. This lift can be done with a vertical or anchor-shaped incision, depending on the degree of sagging. However, this procedure requires removing excess skin and some breast tissue, resulting in a smaller, more natural shape. It won't have the same upper fullness as it did with implants. To create more fullness, there are 2 ways to increase size or upper volume during a lift without implants. Method 1 uses your own tissue, taking the lower breast tissue that would normally be removed and folding it up to enhance the upper breast. This method has some limitations, as it involves taking the sagging lower tissue and folding it back up to provide support and fullness to the upper part of the breast. So, the blood supply might be insufficient, which could cause this part of the breast tissue to lose blood and die. This makes it less successful in achieving the desired breast fullness. The second method is breast fat grafting, which is another option for increasing fullness. However, fat grafting doesn't provide as much volume as silicone implants. After fat grafting, some of the fat will be absorbed. Many studies have found that, in most cases, about half of it will completely dissolve. So if someone has fat grafting for fullness and still feels it's not enough, they can have another injection about 6 months after the first one. There's an interesting study on silicone removal. The first study by Dr. Peters in the United States found that people who only had their breast implants removed felt regret and disappointment as high as nearly 50%. Meanwhile, patients who had their implants removed and replaced with new ones experienced regret and disappointment at only 14%. Additionally, there's another study in the United States by Dr. Netcher. Studying 85 patients who had implants removed, it found that those who only had removal felt their breasts weren't as aesthetic compared to the group that had removal with a lift. Especially in older patients whose breasts are sagging and whose skin has poor elasticity. So, for these 3 groups, having a lift at the same time might be better. But in practice, a plastic surgeon will assess before removal whether the breasts are sagging. If the breasts are already sagging, I'd recommend removal with a lift, but if they aren't sagging, we'll check if the implants are large, or if the skin is very stretched. If the existing implants are large and the skin is very stretched, the breasts will likely sag after removal, so a lift should be done at the same time. But if the implants are small and the skin isn't very stretched, we might remove them and wait about 3 to 6 months for the breast and skin to contract and tighten first. After that, we'll reassess whether the breasts are sagging. If the breasts aren't sagging, then nothing needs to be done. But if they are sagging, a lift can be performed later. As you can see, discussing options when implants must be removed is crucial for patients to understand and decide with their plastic surgeon before the surgery to ensure the best possible outcome. That's it for the two options when breast implants need to be removed. For anyone looking for information or knowledge about plastic surgery, breast augmentation, or breast lift, breast reduction, breast revision, tummy tuck, arm lift, thigh lift, or liposuction, don't forget to subscribe, like, and hit the bell icon so you don't miss any great informative clips from the B-Contour Plastic Surgery team. Please follow the B-Contour Plastic Surgery page by Dr. Pornthep Pongrasmi and our website bcontour.com. If you have any questions, feel free to ask in the comments. Goodbye.